Hi, Dr. Nishant. Hi, Sagar. Hi, Sapriya. Hi, Abhishek. Let's quickly start. People will join in between. Um, Today, the session will be taken by Dr. Sagar Bush, Dr. Nishant, Dr. Sapriya, and Dr. Abhishek. Um, it would be great if you can keep your camera on. It's a request for Dr. Nishant. Yes, perfect. And Dr. Abhishek too. I'll not take much time. I'll just quickly introduce myself. I'm Astha. I'm co-founder of Salah. And the reason we are keeping this webinar is that we wanted to help you all before before writing the UPSC CMS to get a bit more clarity that what each and every cadre holds. Uh, just on the for everyone, how this webinar goes is that first the mentors will tell you about UPSC CMS, and then we will open the panel for the Q&A. So all of you who have any questions to ask with any one of them, please ask it at that particular time. Feel free to unmute yourself at that particular time and ask your question, or you can just drop your question in the chat box and we can answer that. So, but for now, please keep yourself mute so that the session will go smoothly. But don't worry, we'll cover each and every question once uh, the initial presentation will be over. And what I was saying is that the reason we are keeping this call beforehand is that we want all of you to be more informed about what each and every cadre holds before filling your DAF and deciding that which cadre you want to be in. Because DAF is a very integral part of CMS because your interview is going to be based on your DAF and your next level of joining is going to be based on DAF. So you have to be very clear that what each and every cadre holds and what works best for you. It's a small contribution for our end. And or next, it Dr. Sagar, Dr. Nishant, and Sapriya, they knows it well. So we will go to each of them one by one, and I'll share my screen, and they will take the session. Over to you, Dr. Nishant and Dr. Sagar. I'll
Yeah,
just
thanks, Astha. Good evening, everyone. We're going to discuss work culture, transfer and postings, and each of you have different doubts regarding the different cadres. So we have planned this webinar so that all of us directly going to help you solving your each doubts regarding each cadres like postgraduate opportunities. Someone has a doubt regarding transfer and posting. Someone is doubt regarding the work culture, about the work culture after doing the post graduation. So we're going to start with IRHS, then we'll move to the MCD, and we have Dr. Nishant with us. He's going to tell you each and every details about IRHS cadre, and then we have Dr. Sapriha. She's going to tell you about the MCD, and we have Dr. Abhishek, and he will tell about the CGHS. So one by one we'll go. So firstly, we'll start with IRHS, and Dr. Nishant will tell all the details. And at the end, we're gonna answer all of your queries regarding each cadre. So over to you, Dr. Nishan.
Thank you, Dr. Sagar. I hope I am audible to each and everyone. Please, Sagar,
Yeah.
check am I audible?
Yes, you are audible.
Okay. Good evening, everyone. Myself, Dr. Nishan Dhiman from IRHS Batch 2019. I have cleared UPSC CMS exam in 2019 after serving 4 years in Indian Railways as an assistant divisional medical officer in Howrah Division. I was posted in Vardhaman Health Unit from after completing my 4 years. Now I'm pursuing my DNB General Medicine course in BR Singh Eastern Railway Hospital. Now I'm a first year resident and also an IRHS officer. So this session is all about providing you the information about the cadres, what type of work we are doing in different cadres, and once you go through this UPSC exam, how you're going to have your lifestyle balance, as there are many doubts regarding it. So I'm going to give a gist. I hope that if I want everyone to be with me regarding how the railway system is working as far as our medical department is concerned. So whenever you are going to get this Indian Railway Health Services as an cadre, you will be appointed as an assistant divisional medical officer. So railway is working at three levels. One is the health units level, second is the divisional levels, then at the central hospital levels. So approximately 695 units we have in our railway, out of which 55 units are the tertiary hospitals. The hospitals are located in the divisions. So railway has such sub classification. One are the zones. There are different zones. Railway have different zones and workshops. The zones, they can be Northern Railway, Eastern Railway. Like that, there are certain set of zones. Like I am in the Eastern Railway. Then there are certain workshops. So workshops, they are just limited to one place where there is a production work that is undergoing, and they have their own hospitals. After the zones, zonal have the central hospitals. And below the central hospitals, these central hospitals are acting like our medical colleges. Then below the central hospitals, we have the divisions. There are many divisions. For example, let's say in Eastern Railway I'm posted, there are 6 divisions, and Howrah division is one of them. In the divisions, we have the divisional hospitals. So these are the secondary level of the hospitals which are available at the divisions. Then in the most periphery, we have the health units. So the major chunk of our healthcare system of the Indian Railways are being taken up by the health units. And in the health units, the doctors are posted. So how the working is different for different doctors. First, I will take if you are an MBBS graduate. If you are an MBBS graduate, you have the ample of opportunity to get either posted in the these health units, or you can be posted in the divisional, or you can be posted in the central hospitals. Most of the MBBS graduates, they are posted in the health units where you work as a separate entity. You will be the in charge of that hospital. You will be responsible for doing all the administrative work of that area, along with providing emergency and day-to-day services to the employees of the railways, to their family members, and all the retired members which are going to avail benefits through you. Simultaneously, it is the responsibility of the railway doctors to provide first aid emergencies to all the railway passengers. And being working as a railway medical officer, you have to be ready 24 into 7 for any untoward incident that can happen in your jurisdiction area. So that this is the working in the health unit level. So health unit is the basically a primary health center like that. But yeah, most of the responsibility will be of the administrative part. Then the next is the divisional part. In the divisional part, you will be posted under your CMS. Multiple doctors will be there. It will be a hospital setting, and you can be given various responsibilities, not an independent like you get in the health unit level. In the central hospitals, these are the tertiary referral centers for the railways. These are working, they are actually where we have different set of departments. And in the under the departments, you will be posted anywhere and you will be utilized based upon your skills. So the posting, if you're an MBBS, you can get either of these three. But most of the MBBS students, they get in the health units levels. If you are a specialist, then you have a more chances of getting into the divisional hospitals or the central hospitals. But yeah, you need to be sure that the railway can transfer you even to the health unit, even if you are a specialist, if there is a need of providing the doctors to the these health unit levels. So this is the basic primary structure. Whenever you are entering into a railways, you should be aware that there are certain set of things which you have to know. Now, coming to the next part, what are the exceptional facilities if you join into the Indian Railway cadres that you get as far as difference is concerned from other cadres? So, in Indian Railways, being an Indian Railway officer, you are entitled for a 6 set of railway passes. So, you have a 6 set of railway passes. Second AC is completely free. First AC, you have to just pay a minimal amount, and with that you can travel from Kanyakumari to J&K and back from J&K to Kanyakumari, and the same thing you can do 6 times. Railways officers, if you are posted in the divisions, they have their separate clubs. In the clubs, all there is a different environment of the railway where all the officers from the different IB, with the whether they are the engineers from the RPF department. Total we have 11 different sub departments that they come together, and where you can have your club parties. Club functions are there, and also we have in every club there is a provision for the gym, swimming pool, and other day-to-day activities which your family members or your children's and they can do. Along with that, these areas, the railway areas, they are very secured areas which are means they are covered inside. There are special officers colony where you get a type for 5 quarters. Whenever you are moving, being a railway officer, you get the advantage of a railway. You can travel in a railway pass. Pass is given where you can easily travel in your in and around in your areas. That is more important. And right now we have one this portal, Pravas portal. With that, if you are going from one station to another station and you suddenly need one room, then officer rest houses are easily available, which you can book through your tips in your hand tips. And another thing, working, you have probably you must have seen many videos where they have what the doctors are doing in the railways. That is the questions we will take up in that. But the positive aspect that if you are good in a coordination with other departments, and you will have a good life, a balanced life, and more of an this administrative type of life that you will enjoy in the railways. So I think, Dr. Sagar, this just I don't want to take much time. This will be more sufficient for everyone. And later
Yeah,
on, we can take one by one questions related what the people want to ask so that we can know them.
yeah, definitely. Two more points we can add regarding the transfer and postings. Many people have doubt regarding when they will get transfer if they'll be posted outside their hometown, or regarding the postgraduate opportunities, like after how many years they're going to get chance to do the post graduation, or after how many years they'll get chance to do the sponsorship or other quota to reach the postgraduate opportunities.
Okay. Okay. So thank you, Dr. Sagar. Okay. So see, as far as the posting concern is postings are concerned, so there is one when you fill this DAF form and when you fill this notification, it's like you can be posted anywhere in India. So you have to be mentally prepared where you're going to be posted. Some are lucky who are posted by near their hometown. Some may not be lucky to posted in their hometowns. So wherever you will be posted, you have to accept it and you have to enjoy it. Right. Second thing, the opportunities to get back to your hometowns, it depends on multiple factors. So we are not going to lie. The truth is that the first preference is always given to a spouse ground. If your wife is working or your husband is working in a central government, he or she is an officer, then you will be given a more priority. But it will also take up to 1 year to go through these multiple step processes. Second is through request basis, that only depends if there is a vacancy and if you are being released from your zone, which may take time. And that time, it we cannot predict it, how you're going to be there. So as far as these postings are concerned, and most of our RHS officer, even Dr. Sagar, myself, we are not posted our hometown. But yeah, wherever we are posted, we have utilized these opportunities and we have done a great deal. So that is more important. Second concern is regarding the getting into the higher studies. Yes, definitely railways is going to provide you this special IRHS officers quota, and the duration, it really varies from zone to zone. We already have two examples right now in our panel. The Dr. Sagar, he will himself tell how he got the this opportunity to get into the this residencyship. He has already completed and now he is a surgeon. And for me, it took me for 4 years to justify to my zone that yes, I'm capable. Now you can going to relieve me. But yeah, there is a certain set of guidelines that has been released from the railway board. That is the 2 years. But depending upon the requirement of the zone may send within 1 year also, and zone may take up to 4 years. So it depends from zone to zone basis. But definitely, wherever you are posted, you will get the chance to pursue your higher studies. You may get it early or you may get it early. That is up to the time and up to the zone. We cannot predict it. And these IRHS quota, even if you not able to secure a very good or a very high rank, still you get the opportunity to pursue the branch of your dream. So it's a very good thing that the railway is offering to us. Yeah, over to you, Dr. Sagar.
Yeah, thank you, Dr. Nishant. Now we'll move to Dr. Safriya, and she's going to tell you about the MCD. Before that, we'll move to Dr. Astha, so that she can start with Safriya.
Uh, yeah. So we will move to Sapriya, and Sapriya have a very different journey. She has joined AIMS. She has done her anesthesia for 6 month PG, and then she left her job. She left her PG and joined the like CMS service. So she will tell you more about her decision, why she took this route, and what are the pros and cons, and yeah, and more about her service. So over to you, Sapriya.
Hello everyone, this side Dr. Sapriha here. I am currently working in MCD. Delhi Municipal Corporation of Delhi. I have cleared my UPSC CMS exam 2023. I did my UG from IGMC Shimla. I am junior of Dr. Nishan. And first, I would like to wish a very happy Women's Day to all the pretty ladies there. Uh, I joined anesthesia residency through INICET 2020 uh, 4 November. Then from in the very beginning, it was एम्स बठिंडा बेसिकली. सो एक महीने में मतलब मुझे लग गया था कि वो ब्रांच मैं नहीं कर सकती हूँ, जैसा मैंने सोचा था वो वैसा नहीं निकला. तो और भी कुछ रीजंस थे, थोड़ा कॉलेज भी मुझे ज्यादा पसंद नहीं आया और ब्रांच से मेरा मेजर इशू था. सो इन द बैक ऑफ माई माइंड मुझे था कि मतलब मुझे थोड़ा एमसीडी रखा था मैंने. उस टाइम पे मैंने मार्च में एक्सटेंशन डाल दिया था. मतलब इस पे एक प्रोविजन रहता है कि अगर आप पीजी एग्जाम निकाल लेते हो उसी ईयर में जिस टाइम पे आपका सीएमएस क्लियर होता है, तो आप एक्सटेंशन के लिए भी अप्लाई कर सकते हो. तो उसमें 3 इयर्स तक आप पीजी का करते रहो, उसके बाद आकर के आप इधर वापस ज्वाइन कर सकते हो. तो उस टाइम पे मैंने मार्च में एक्सटेंशन के लिए डाला. देन आई डिसाइडेड टू रिजाइन फ्रॉम देयर इन, बट वहां पर मतलब थोड़ा टाइम और दे करके देखा, बिकॉज इट वॉज ऑब्वियसली अ वेरी ग्रेट डिसीजन फॉर, बिकॉज वो लाइफ टाइम आपके साथ रहता है ब्रांच. तो उसके बाद मैंने वहां पे फिर 6 मंथ तक कंटिन्यू किया और उसके बाद फिर देन फाइनली आई डिसाइडेड टू रिजाइन फ्रॉम देयर एंड फिर मैंने यहाँ पे ज्वाइन किया. एंड उसके बाद यहाँ पर जब मैंने ज्वाइन किया तो यहाँ पे डिस्पेंसरीज होती हैं और हॉस्पिटल्स होते हैं. मतलब इसे जब हम वो ज्वाइन करते हैं तो 3 कैडर्स रहते हैं बेसिकली. एक रेलवेज का रहता है, एक सीजीएचएस रहता है और एक दिल्ली रहता है. दिल्ली में 2 आते हैं, एक एनडीएमसी आता है और एक एमसीडी आता है. तो मुझे जो था वो एमसीडी वाला मिला और यहाँ पे मुझे हॉस्पिटल मिला. एंड देन आई ज्वाइन हियर इन नवंबर 2024. इट वाज 8th of November. एंड सो उस दिन से लेकर के अभी तक तो मतलब मुझे ऐसा नहीं लगा कि मेरा डिसीजन गलत था. इट वाज एक्चुअली अ ग्रेट डिसीजन. एंड सो नाउ कम टू सम पर्क्स कि यहाँ पर क्या बेनिफिट्स रहते हैं. सो फर्स्ट ऑफ ऑल एमबीबीएस करने के बाद हम लोग को लगता है कि हर जगह पे हमने हायरार्की कॉलेज में वही देखी होती है कि पीजी करो फिर एसआरशिप करो फिर कंसल्टेंट बनो, और सब में टॉक्सिसिटी चलता रहता है, वर्कलोड जो होता है वो बहुत. बट ये ऐसा प्लेस है जहाँ पर जैसा कुछ है ही नहीं. सबसे चीज की ये है, यहाँ पे मेंटल पीस मिलता है पीजी करने के बाद, मतलब एमबीबीएस करने के बाद. ठीक है. एंड द सेकेंड थिंग इज दैट कि सबसे जो अच्छा इसका वो है, इट्स परमानेंट ना. क्योंकि आज के टाइम पे कोई भी स्टेट जो है वो एग्जाम नहीं करवा रही है. इतने टाइम के बाद हिमाचल में अब शायद एक एग्जाम अभी ले रहे हैं ये लोग मार्च में, एंड राजस्थान गवर्नमेंट ने भी निकाला है, हरियाणा ने भी. आफ्टर मतलब इतने टाइम के बाद ये लोग एग्जाम ले रहे हैं. तो ये वाला ये इसका बहुत अच्छा है कि ये परमानेंट जॉब है. एंड द थर्ड थिंग जो इसका सबसे अच्छा है, सैलरी करने के बाद सबसे सही जो मतलब सैलरी का देखें तो इसका रहता है.
Hi,
हम लोग
Yeah, hi, Sapriya. Sorry to stop you in between. Can you please speak in English? There are a couple of people who don't understand Hindi and they are. Um, Murugan,
okay, okay,
sure, we'll have it in
so
English.
Yes, ma'am.
okay. I forget that some people are from south. Oh, okay. So the other thing is that so I will start once again the perks of this. So first of all, the thing which I was telling initially is the first thing is peace. So most important, and the very first point is no toxicity at all. And the second thing is the job permanency. As you know that many states, like the states of South, now northern states are becoming like that. No exam for MO and all. So this job gives you permanency. And the other thing is that salary. We are at level 10. After MBBS, it's a nice package. And it's not like this will not increase. This will increase gradually with time. We will come to the level of grade 11, grade 12, grade 13, and it will go till level 14, I guess. And the working hours. In MCD Cadre, there is approximately 36 to 40 working hours per week. So it's divided basically like I'm working in OPD, so I have to go for approximately 6 hours per day. But my colleagues, they are working in emergency, so they divide their duty accordingly and they get rest full day off. Like if they do 24 hours continuously, they will get the rest of the 6. They will get 5 days free. So we have plenty of time. And the other thing is that it provides us so much of time to figure out what to do in life. Like some of my colleagues started preparing for CSC, UPSC CSC examination, and others are planning like what to do. They are having plenty of time to figure out what to do in the life. And next, coming about the holidays, we are having all Sundays off in OPDs, and all the government holidays are off for us. And we are having EL, CL. Beside that, we are having medical leave also. So there is no much issue for leave. We can get leaves easily. And the posting in MCD Gather, the best thing is that you are working in Delhi. You are not going to post in your state, and there is no transfers in MCD Gather because it comes under Municipal Corporation of Delhi, which is an autonomous body. And the other thing is residence. So many of my friends were asking, um, will this MCD provide residence to you? So the answer is yes. MCD has residents. They are actually nice residents. At some places, it's actually very nice. And in my hospital, the hostels are also there. So we can get that also with time. And the PG thing. It's not like that we are not eligible for PG after joining this CMS. We can do PG, but with time. In this, we are having three categories. Like we can get extraordinary leave after 2 years of serving here. And after 3 years, we can get quota for MDMS in hospitals. And 5 years, we can get quota in Central Institute also. And the after PG life is also we can do PG, and we can join back here also. And the at last, I would like to say that if you join MCD or some other cadre from UPSC, then you are having the option to continue with this branch, or you can go with your dream branch and dream college. You are not like you do not have to compromise with the dream branch of yours. And so at last, I would like to conclude by saying this: it's basically the up to you only. It like it's not a bad option because like MCD is also before coming from here, I have also heard like that MCD is not good, but it is not like that. It's actually very nice, and I am enjoying here. You can trust me. So thank you.
Uh, we
Okay,
have
thanks,
one.
Sapriya.
See,
Yeah,
so Sagar, we have couple of questions. Can we just? I think that is for Sapriya. So let's just cover that and then we'll move to Abhishek. That's okay.
yeah, two,
So,
three questions we'll take and then we'll move to Abhishek.
yeah. So the question is that what is the minimum starting pay in MCD cadre?
Yeah, yeah. In the MCD cater, the as I already told you, we are having so 56,000 base plus other allowance like BA, transport allowance, and HRA. So we get 1.14 after cutting all the tax and all. So currently we are having 1.14.
So in all, how much? It's 1.14 J in every cadre.
What?
I think it's different or same.
Yeah,
Sagar.
it's same for everyone in each cadre.
Okay, so it's the salary is same in every cadre, and there's one more question that Khushi is asking. Please tell order of cadre one should prefer. Khushi, it's a very personal question because people have preferences which city they want to settle in, which kind of jobs they want to do. So cadre is a personal preference. You can get more clarity and then decide that because somebody wants to settle in Delhi, they don't want to leave Delhi at any cost. So for them, MCD and NDMC is the best option to go ahead with. Uh, we will come back to another question. Salary is one thing we wanted to cover. That's why I've stopped the meeting in between. Let's move to Abhishek and we will cover CGHS and then we'll come back to questions. Feel free to keep dropping your questions here. We will come back to it in a while.
Yeah, put your questions here. After Abhishek, we'll come back to you and then we'll answer each and every question.
Abhishek, over to you.
Hello everyone. First of all, I would like to thank Salah Shots for giving me the opportunity to represent the CHS cadre here. So, whenever we are talking about the CHS, the first confusion that everyone is having that some people think that CHS and CGHS are the same thing. I would like to clear this thing that CHS and CGHS is not the same. CHS is a big umbrella under which there are so many subcadres, and CGHS is one of them. Other than CGHS, there are other subcadres too, like Ministry of Labor, then Port Health Organizations, then Land Port and Airport Health Organizations. These are also under CHS. But if you are posted in CHS, most probably most of you will be posted in CGHS. It is having the most of the number of doctors, but some of you may be posted to other subcadres too if you are posted in CHS. So because I am working in CGHS, actually I am working in CGHS Guwahati. So I will be discussing about the CGHS cadre only. So first, work profile and responsibilities. So in CGHS, after if you are a MBBS graduate, most probably you will be posted in dispensaries. Yes, there are hospitals too under CGHS. The central hospitals are there, like Safdarjung RML. But most probably you will be posted in dispensaries if you are an MBBS. If you have done your PG, then there are chances that you may be posted to central hospitals too. So in dispensaries, you will be posted as a medical officer, and you will be doing mainly OPD basis work. IPD is not there in CGHS dispensary. Administrative versus clinical work. So, if you are posted as an in charge in your dispensary, then you will be taking care of the medicine stocks available in your dispensary, and you will be signing all the files, and you will be forwarding the demand requests to your higher authorities for to meet the things that are required to run your dispensary. And you will be also forwarding requests to your zonal additional director to issue certain medicines. Mainly, these are the restricted medicines, monoclonal antibodies or anti-cancer drugs, which are very costful uh, for some particular patients. So these are your administrative duty. And the clinical work actually under CGHS in every city, wherever the CGHS is there are some corporate hospitals which you call the empaneled hospital of CGHS. So people around 50% people will come to get the consultation. You have to approve them to get consultation in any CGHS corporate hospital. Okay, and many people will come to repeat the medications which they are already continuing, and rest of the half of the patient, they will come with some common ailments, and you will be treating them on OPD basis. There is not the facility of this IPD is available, so you will be treating on OPD basis. And duty hours. So the duty hours, the dispensary starts around 7:30 a.m. and it is closed by 2 p.m. So you will be working between 7:30 to 2 p.m. After 2 p.m. You are free, and rarely you will be receiving any call from your office. So after that, you are totally free, and you can pursue your hobbies, or you can give time to your family, you can travel, or whatever you want. Holidays, actually, all the Sundays are holiday because it is a OPD. You will get all the gazetted holidays too, and you will get CL, EL, and medical leaves too. So this is regarding the holidays. Salary and perks. So like all the cadre, actually every cadre is same regarding salary. So you will be getting the level 10 of 7 CPC, and your basic will be around 56,100. But as CGHS is present all over the India, so all the cities are not same. You will the house rent allowance will be varied according to your cities. If you are posted in a X category city, this metropolitan cities, then the salary will be house rent will be higher, so the overall salary will be also higher. As I am posted in a Y category city, Guwahati. So here my gross salary, including all the allowances, is more than 1.2 lakhs, and I am getting one around 1.10 lakhs. So this is regarding the salary. And regarding parks, so there are some other allowances too, which are not included in your salary, but you will be getting them on means 6 monthly or annual basis. So you'll be getting these things, and there are facilities of CPWD quarters available, and central government guest houses are also available in various cities of this country. So if you visit there, you can stay there with free booking. Postings and transfers. Though the CGHS central hospitals, these are available only in Delhi, but CGHS dispensaries are available all over the India. Most of them are in Delhi only, but they are available throughout the India, and they are available mainly in the big cities. And transfer transfer is not very common in CGHS, but you can get transfer on your request if the vacancy is available, and if there is no manpower shortage in your place current place of posting, then you will be released and you may get transfer. But it is not guaranteed. It depends upon the availability of vacant posts. Career growth and promotions. So the CGHS officers they get this dynamic assured career growth program, under which there is time bound promotions. After serving as a medical officer for 4 years, you will be promoted to this senior medical officer, and after serving as a SMO for 5 years, you will be posted as CMO, and after serving CMO for 5 years, you will become a CMO NFSG. So promotions will be going like this on timely basis. PG and further studies. So for PG, there are two types of leave. If you complete the 3 years of your service, then you are eligible for EUL, that is extraordinary leave. But extraordinary leave approval depends upon the manpower availability of your area of posting. If there is adequate manpower, then you will get this EUL. And during EUL, you will not get the salary, but you will be getting the stipend in which college you are pursuing your PG. And after 5 years of service, you will get the study leave, which is usually easy to get. Actually, it is easier than getting UL. And in study leave, you will also get the sponsorship quota, and you will get your salary while you will be doing your PG, but you will not get the this stipend from the college, but you will get your salary, and your years of pursuing PG will be counted in your service, and you will get the seniority too accordingly. So that's all about the CHS cadre. If you have any doubt, you can tell.
Yeah, very good, Dr. Abhishek. So now we're gonna tell you every doubts. So we'll start with Dr. Nishant.
Just I want to hear those who have joined back after my this session. See, the most of the work in the CGH and MCD cadre will be oriented like being a profile of a doctor and working in this if you are an MBBS in the primary setup. Whereas the work in the railways will be more of a like an officer, you will have an administrative responsibilities and you will be engaged 24 into 7. So as if you have listened to the Dr. Sapriya and this the working in the CGHS cadre, they you get ample of time to do other things. But yeah, but in the railways we have one thing that I want to clarify each and everyone, that is we are bound to our headquarter. So it's a working, though we are not in a uniform, it's working like more of a this army type. We are bound to our headquarter. That is, we cannot leave beyond 8 kilometers. We have to be present inside in the headquarter, because as you are aware, we are continuous traffic is going on. The railways are continuously working. Any untoward incident happen, any accident can happen. Then all the team members should be available there. So if this is more of a responsible job, you may not be called after your duties if you are in a divisional hospitals or the central hospitals. But if you are in a uh, this health unit levels, then you cannot leave and you can not be go beyond, because anytime if accident happens, you will be called, and that is basically being everyone knows these are the stations or the emergency calls. So it comes at a cost. The cost is that there is one I want to share. The most of the people, they have not addressed it. In railways, if you are posted in the health units level, the most in thing that you are the senior most officers who have qualified the UPSC. So the most of the times, if any function is there, you will be appointed as a chief guest. You will be the representative chairman of various organizations or your union members, and all those things you have to take on. You will be visiting various schools. Any functions will be there. You will be appointed, called as a chief guest, and you will address to that population. So you will be treated as a king. So most of the railway doctors who get posted into the previously, they used to spend their 30 to 40 years in that health units only, because they are being respected there and everything goes fine for them. So that's how there are certain perks, and the working in railways, it's not that much easy, which can be explained only in this session. So I think if a Sagar allows, the railway working has to be explained in each and every aspect, or I would recommend the people to go into the Facebook profiles or the Instagram profiles of Sagar and mine and see what actually we are doing. So it's not just a limited job of 8 to 2. I cannot say that 8 to 2. You can be called at 2 p.m. in the night or somewhere in the night and you have to come. So more of a working is like an army, though you are posted in a station or in a good city. That is a different part that I think the questions will come up, then we can take up when we
Yeah,
are comparing.
I think we'll start with this question, that what is the work satisfaction in all cadre? And there are a couple of questions revolving around the work and the type of cases they get exposure in each and every cadre. And is MBBS enough for CGHS? Okay, so let's start with the type of exposure they get in each cadre. Um, so Nishan, Sagar, Abhishek, Sapriya. So the kind of exposure you get after just joining to the services as an MBBS student. I think all of you have joined just after your MBBS, and now Sagar have completed his PG and Nishant is pursuing his PG.
So I have joined in November, as I already told you, after doing MBBS. Mine is a hospital. So every specialization is there: medicine, pediatrics, dermatology, psychiatry, every department is there. So mine is like I am doing OPD. I was posted in Ophtha OPD and in Dhamma OPD also. My working hours are from 9 to 4 and they are fixed. And I'm getting leave of like all the government holidays, and Sundays are off. There is no toxicity, and off after 4, I'm free. There is no nights in OPD. And my colleagues who are posted in departments like emergency medicine and in gynecology, they are having shifts like after doing 12 hours per day, they will get next 24 hours off. As I already told you, we are having fixed working hours per week, 36 to 40 hours per week. It's up to you how you want to do that, like how you want to divide among yourselves. You can divide it into 24 hours or in 12 hours. If you divide it into 24 hours, then you do one day 24 hours and the next day off, and then another 12 hours full day and the whole week off. All right, so mine is like this, so it's not hectic.
Okay, so we will get exposure to, because there's it's a hospital, there is specialization available, so you can get an exposure to work under
Yeah,
to see multiple cases.
yeah, every kind of case is available here in every super specialty. So we are having as I told you that I am working in dermatology currently, so every kind of lesions are here, and OPD goes approximately 90 to 100, 9 to 1 duration, and 9 to 1 duration, approximately 100 patients come daily on daily basis. And And same pediatrics also, same in medicine also. Every kind of exposure is there. And in our other hospitals like SDN and Kasturba Hindu Rao, OTs are also functional in every hospital. In our hospital, in gynecology department, cesarean section is also available. So a good exposure is here. It's not like that we are not getting the work of MBBS only.
And what about you, Abhishek? How is it in CGHS cadre?
In CGHS, you will see all kind of cases that are that you can see in an OPD. So every day I see around 70 patients on an average. Sometimes it goes up to 100 also. So I see all the common cases mainly. Some of the rare cases are also there because after getting treatment from this empaneled corporate hospitals, they come to us for the follow up. So we see all kind of cases, but you cannot expect to see these emergency cases because this is not an hospital. This is a dispensary only. So you see the OPD cases, but emergency exposure to you will not get here because this is dispensary only.
Okay. So there's one question that how is it to decide which cadre to get after CMS? Is it based on DAF, right, Nishant or Sagar?
No, 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 no. Let
Okay.
me put the end to this dilemma everyone is having, right? So everyone has a different priorities in their life, and you cannot tell that which cadre is best. It's like which cadre suits you the best. That is more important, right? If you are a person who is living in the northern side and you wanted to have a posting nearby at your home, then first, if you somebody is having this priority of a posting, then definitely that person should choose an MCD cadre. Second, if your priority is to have a work-life balance and you wanted to be posted in some dispensary like setup 8 to 2 and you don't want to call, then the CGHS or CHS cadre will be a good opportunity. And the third one is those who are interested to be a part of an Indian Railways and who work like who wanted to work in like an officer. Yeah, you will be engaged more around the clock and who have seen the working in the railways, then that where they come these railways comes up. So in that way, you have to decide the cadre. The second thing is that even deciding the cadre is like when you want to come to join these services, whether you want to join with the MBBS, if you have some difficulties in your life or a financial stability, or you don't want to pursue right now. Like me, I wanted to have a financial stability first, and after the financial stability, I wanted to give us just a somewhere break in my study so that I can check what type of branch I need in the future. So I wanted to join this UPSC services. So that's how I took these services first. Otherwise, the most of the people like Sapriya wanted to go for this specialization first. She took the extension and then she wanted to come back. But later on, she realized that, yeah, she is not fit for the anesthesia. She wanted to come to join back. So similarly, in everyone, the whole motto of this discussion is to everyone should be aware what type of work is being done in which cadre. And even after, if you want to choose, let's say I wanted to choose CGHS cadre, but my rank was not good. So again, I will be put down into the railways cadre. So your rank will also decide which cadre you get. So we cannot prioritize that which cadre is the best. Everyone will have a special set of these prioritizations. So I have recommended many people the railways first as a cadre. After knowing what they want actually from their life, I have recommended MCD to many people after what they actually want from their life. And many people, they have just come up and they said, okay, we wanted to go to this CHS cadre first because these are our requirements and it better suits to that cadre. So this is the right answer to this question. Over to you.
There is one question regarding internship that there's a question that
Yeah, when you want
I'll
to
be
do the,
appearing during my internship. Suppose if I get selected, still there will be 7, 8 month extension. So it's about I'm in internship and what is the extension, how much month
yeah.
extension I'll get.
Okay, that is a very good question. Many of these candidates that we are training, and even myself, I appeared in this exam during my internship. I cracked this interview during my internship. After the internship, during the last day of your interview, let's say it's 1st of January. It is the day of your interview. From 1st of January, they give you 6 months. So they let's say after the till 6 months, you have the time to submit your documents and within that period of 6 months, your internship should be completed. So basically, that should be in the mind that you have from the date of the interview, you have 6 months in your pocket. So that will be your period. So you can calculate from that. If you are able to do it, then it's very good. Even if you're not able to do it, then you can request the UPSC to give you a 10 or 15 days extension. If they agree, then you can join back. So it won't be a problem. Your focus should be to give the exam, to crack the written, to crack the interview. Then later on you can see. Anything Sagar want to add? He can add, please.
Yes,
Yeah,
Abhishek, please go ahead.
yeah, Abhishek.
Abhishek is.
Actually, I have also cleared this during my internship. So I'm telling you my experience that during our time, that is CMS 2023 batch, when the actually when I have appeared for this interview also at that time also I was going through my internship only. So after publishing the result, the UPSC has put certain roll numbers under provisional list, and they have mentioned that after publication of this result, you have to show your internship completion certificate within 6 months of publication of this result. Otherwise, your candidature will be cancelled. So it was
Yeah, yeah,
given from the date of publication of result.
Six
yeah, yeah.
months. Basically,
Yeah,
six
six,
months.
six months will be given basically. Yeah, one question is very important. Many people faces this. What are the challenges if one get post in the states other than home state, like language issue, how to enjoy social life in other states? So Nishan gonna tell you this
Yeah.
important thing because she's posted in the eastern part of India and she belongs to Himachal Pradesh.
Yeah, so see, our batch was 2019 batch. It was a COVID batch. Not just me, most of our friends from the southern states, they are posted in different areas of Western Railway, Mumbai, Rajasthan, and some of our friends who got posted in the Eastern Railway also and in the northern side. So all of them they have adjusted to it. It's because once you are posted in a new place, you going to it gives some there are certain cons and certain pros are there. So the biggest I always say ki, yeah, you will miss your hometown. Yeah, you will miss your place. Yeah, but once I have come after now, recall back my 4 years, then it's a great learning experience because you are just exposed to new culture, new food items, new people, new different things that you come and you learn. So if you that thing if you keep in mind, then you will be more happy. And if you just see how you then that will be it will be impossible for everyone. So everyone knows the even the Sagar who is posted in the this Badarpur division, Assam, we enjoyed their culture, we dance, food, everything. So we get used to those with these peoples and we try to learn from them. So you should be have that because in railways, if you are going to get posting and you want to get into the higher post, you will be posted into multiple places. So you are going to witness the whole India. So we started our journey from Vadodara. So in the initial training phases, we were in Vadodara. So we learned the culture of the Gujarat. Then we were taken out to the eastern side for this our Bharat Darshan. So we learned some culture of this Bharat Darshan. Now, now we got in Eastern Railway. So I learned all the Bengal culture and speaking the Bengali and the different languages. So it's how you have to means continue with that. Yeah, over to you, Sagar.
There is one question that after joining work, if we get seat in NEET PG, will we be able to discontinue?
Yeah, it depends upon which category you are in there. You have to put a notice, and in railway, they put 3 months salary. You have to return back. That if you want to discontinue services because it is the cost of your training, you have to give back that 3 months salary. And yeah, you can proceed, and at any time you can resign. There is nothing like that.
And can cadre be changed later? Can we change? No, right?
No, no, it's not like that. You can change the cadre. There is one term that we call it as a pay protection, which allows or not. Let's say if you are in a basic pay, we start. I think many of you are not aware of this basic pay. So basic pay is the initiating salary on which your dearness allowance is fixed. So it's like a 56,000. If your higher authority agrees, and if you have a justifiable reason that one of my senior who was posted in the MCD cadre, his spouse was posted in the railways cadre. He wanted to come and join back to the railway. So he was from 2014 batch. So from 2014 batch, he joined the railways in 2022 batch. So there is a difference of 8 years. So with 8 years, how the increments he has get, let's say from 56,000, he reached to the 75,000. The higher authority agreed, the UPSC agreed that yes, you can join. If you clear, we will going to give you the pay protection. Then after that, you can come to the another cadre. After appearing the exam, qualifying it, then you can come and your pay was not going to start from the basic, it will start from the last pay, that let's say 75,000, then it will start from 75,000. But it should be on a justifiable ground and the higher authority should agree on that.
Yeah, one more thing that people can get deputation to the other cadre for 5 years. So this will be the one more chance you can go to the other cadre, but just for the 5 years. Again, after 5 years, you have to come back to your cadre.
And regarding private practices,
Yeah,
there is a question.
that thing we cannot means it should not be inappropriate to discuss on this platform. है ना?
No, I
So
think
as far
it's
as
not
the
allowed. Legally, it's not allowed to do any
so
private
as far as
practice.
the rules are concerned, rules clearly say that if you are getting a non-practice allowance, then you should not practice.
Yeah, and I think it's applicable to every cadre, right? That everybody is getting anyway non-practicing allowance.
Yeah. So as far as the rules are concerned, then legally you are not allowed.
Yeah.
Yeah,
And
someone has
is
posted like, are there compulsory posting in Jammu and Kashmir or any Naxalite areas? No, nothing like that in any of the cadre of the UPSC CMS. So chill.
is training given? I think IRHS give training in Vadodara, or every cadre have training before joining the services. For
Yeah,
Dr. Nishant, then yeah.
yeah, Abhishek and Safriya will tell about the CGHS and MCD training.
Uh, in MCD, there is no training per se. I directly come here and join in the hospital, and my friends who are working in the dispensaries, they are having training of say approx 1 days. There is no as such any route training before joining in the MCD cadre.
And for
Next.
Abhishek, you?
So for CGHS, there is also no mandatory training before joining, but after joining, after 6 months, it varies actually. Some batches for them the training has been organized after 6 months of their service. For some batches, it was after 1 or 2 years. So training, they do we do training, but actually it is not fixed after how many time of joining the service we will be called for training.
What is the duration of that training, Abhishek? Duration of that training?
It is as far as I know, it is around 3 months.
Okay. And I guess in IRHS, Sagar and Nishant, like correct me if I'm wrong, you guys have a proper training in Vadodara, and you have gone through that Bharat Darshan thing before allocating to your divisions, right?
Yeah, it starts with the 7 weeks of field training. You'll be posted in 7 different zones all over India, and then you have 1 month of foundation course, and at the end, 2 weeks of induction course, including the Bharat Darshan.
Okay. What about toxicity exist in this field?
If you compare with a medical college, there is no toxicity. It totally depends on you and yourself only, ki how you're going to deal with other colleagues of your different departments. So if you compare with the medical college, there is no such any toxicity level.
And I think Sapriya have already covered on this point. She emphasized it that there is no toxicity in NCT cadre. Abhishek, how is it at your place?
No toxicity is
There is
there.
no
If we compared it with these medical colleges, then there is not at all that kind of toxicity is there. From use everyone from your colleague to your senior, everyone is very cooperative. Everyone treats you with dignity. Uh, Nothing like toxicity kind of thing.
Yeah, one question is there in IRHS, is only intra-zonal transfer or inter-zonal transfer available? You'll get both type of transfers like intra-zonal and inter-zonal, but the thing is that most of the people are appearing in the UPSC CMS nowadays are from southern part of India. So all the vacancies in the southern part of India are full. So definitely you're going to get posting in northern part of India or in the eastern part of India. So getting the interregional transfer back to your hometown, it's not easy because already more than 500 people are in a queue to get transferred to your hometown. So getting posting in your hometown and getting easy transfer to your hometown is not easy. Approximately 3 to 5 years it will take if you don't have any quota, like Nishant already explained about the spouse quota and other thing. So if you have a spouse quota that like your wife or husband will be in central government or state government working in your hometown, then you'll have a high chance of getting the transfer to your home. Otherwise, you have to work in their parent area at least 3 to 5 years.
There is one question from Jay. Is he's asking that how Salah can contribute in CMS selection. Okay, so Jay, on that ground, Salah is just trying to bring all the mentors or the people who are in those services closer to you so that you can just talk to them and get your questions or any particular details you need before making any decision. You can talk to them, get learn from their first-hand experience or get your question answered, which is a very personal question. And coming back to in your preparation part, yes, there are mentors who have cleared CMS 2024 or the 23. They will help you when you're in preparation. So there are mentors who can help you in preparing the written examination, the interview part, or just having a one conversation to get a clarity. The way he asked about internship, I think just learning have this then he needed clarity more on internship part. So if you have any question, you want to get clarity before deciding is CMS is something you want to even give an try to, so you can talk to any of the mentors and get your question answered. Or if you want help in preparation, you can take their help. There is a long mentorship going on. You can prepare with any particular mentor who have cracked CMS, or they can help you with your interview prep. So there are mentors who will help you at each and every stages, whatever is your requirement. They will be just your buddy because they are in the service, they have cleared the exam recently, and they are just trying to help you at each and every stage.
Yeah, one more important question is there. Abhishek will answer this. In CGHS, once we get our preferred, if you want to join under CGHS, do you get to choose which place, or is it allotted based on the rank?
Yes, this place selection is there, but it is not for CGHS only. Actually, you are given the option when you appear for this interview, and everyone is given that option to choose their preferred place of posting. So this is not particularly for CGHS only. This is for everyone. They will ask you once only during your interview. After that, no, you will never get any chance.
So is it easy to get what we want to choose as a place in CGHS cadre?
I think for North Indian people, it is a bit easy, but for other parts of India, especially Southern India and Northeastern also, you may not get your means home posting.
Okay, thank you,
But
Abhishek.
after that, you can apply for your home posting, but it is not guaranteed that you will be getting. But if the vacancy is there, then you can get.
And
One
what
more
is the
question is,
uh,
yeah,
Sagar,
yeah,
can we
continue.
just cover on this question that the way we have clarified on internship part for FMG graduate, when they can set for this examination and what is they have to keep in mind?
So for the FMG people, firstly they have to clear the FMG exam. After that, they are eligible for appearing in the UPSC CMS exam. And after completing the internship in India, they can join the CMS services. So just as like in India, if you are cleared your final year MBBS and you are in internship, and just like same for the FMG, like they have cleared the FMG exam and doing the internship. So similarly, they can appear for the UPSC CMS, and after completing the internship, they can join the CMS service.
And there is one question that how you can connect with Dr. Nishant. Dr. Nishant is all available on Salah Shots. I will put his profile here. Just go ahead and block your time with Dr. Nishant, and then accordingly you can have your personal one-on-one session with Dr. Nishant.
Yeah,
We
one more
have
question. Yeah, Nishant, continue.
Yeah, we have there one question that after sponsorship we can live. Since you are getting a sponsorship, what basically it means? And in sponsorship, that particular cadre means the government of India is giving you a salary for 3 years and one quota in some institute to pursue your post graduation. So definitely they are going to fill a bond from you. Then only they are going to release you. So you are a bond bound. If you're a bond bound, you cannot easily run away. Okay. So if you want to such type of things, then definitely the most of the question that what we can do, see, if any one of you wants to build up a private practice at your hometown, so instead of coming to these services, it's better not to come to these services because it will take a time and you will waste more and more time. So better whatever you do, you pursue higher studies or everything, you try to get back to your hometown to start your private practice because these services may or may not lead to your this definite target to build up. Though in many years it will take, but it will not be so easy in early phases where you want to take the opportunity, you want to go, you cannot. Coming to central services is easy, but when you leave, you have set of rules against you. You are an officer which is who or who is appointed by the President of India. Once you are appointed by the President of India, the basic thing is you cannot move out of India without the permission of your higher authority. So you can imagine the rest of the things that are imposed on you. Okay,
Jay,
that's
you
all.
have raised your hand. Feel free to unmute yourself and ask your question. I think he want more clarity on FMG. He's going to start his in, yeah.
Please ask him. Please, he if he can show his video also.
Yes, Jay, are we audible to you? Okay.
Yes, ma'am.
Hmm, hmm. Yes, Jay, please ask your question.
Yeah, yeah, ma'am. I just asked in chat that I have just passed my FMG actually, and will be starting my internship in June, right? So, can I be able to join the services if I get my result pass in CMS? Next year will be the posting, no?
Yeah. The thing is
That
that
was my
the thing is
question.
that the thing is that you'll start your internship in June and the exam will be in July. So result will be in August or September. So you'll get one month for filling the DAF. So before filling the DAF, DAF will be filling will be in September and result will be in October and November. So before that, after publication of the result, in October and November, maybe in October or November, till 6 months. If you in that 6 months, if you are completing your internship, then it's easy for you to join the service. Otherwise, they'll not allow if you're not completed your internship. Take it like uh, December, January, February, March, April, approximately March or April.
In March or April, I'll be having like 10 months or 11 months finished, but not exactly 12 months. So I don't think that they will give me internship completion certificate before June, right? So will it be worthy if I, uh,
See,
Yeah, Nishant.
yeah,
yeah,
please. Dr. J. So that comes in the whether it will be worthy or not. You first give appear for the exam first. That we will see.
yeah, yeah,
Appearing in the exam and giving the interview is the first part. Most of the people who are paid, who are easily they have gone through the written exam, they are not able to qualify the interview though they are very
yeah,
good in
exactly.
yeah. So whether you will be eligible or not, even many of the candidates who are in the final year, they are asking me or Dr. Sagar that we want to appear for the exam, we want to get an idea how it happens. So they are ready to give the exam, even they know that they are not going to get into this service, but they are ready to give the exam. They are saying,
Uh,
okay, sir, whatever will happen, we'll see, but we want to face this exam and we'll see how the question paper comes because it's a two-shift exam, not a one-shift exam. On particular service,
yeah,
you will have a morning shift, then you have a second shift. Once you qualify the appear for these two shifts, then you are going to have an interview session. That's not going to happen in your NEET PG or somewhere you're going to give a counseling. So interview is again a different set of whole preparation which it requires. Okay.
yeah, exactly.
So the
And I
eligibility
just,
will be the late. So you go through your internship, you appear for the exam, then whatever will be the last, then we can see on that whether you will be. Don't worry about it right now. Okay,
yeah.
you start
And
preparing.
can you please enlighten about the preparation that what book or what source to study and all?
Astha, we
Yeah.
could take on this question or we put it on another because it's going to be a whole
Yeah,
different segment.
Yeah,
I think
we'll plan.
we are already ahead of time. And Jay and others, Subra also have the same question. This session is more about giving you clarity on different cadre of UPSC CMS. We are going to have a session in a week or so where we will discuss everything about preparation strategy for UPSC CMS. So you can ask your question there. That will be completely based on how to clear the written examination. And then later on, we can have another session on interview part. So this is only for cadre clarity. Don't worry, we'll have the preparation call very soon. Yes, Morgan, you have
Yeah,
raised your hand.
Morgan.
Sir, our clinical practice is going to improve or it will be static during this service?
Can you repeat your question, Morgan? I think your voice is not that clear.
Sir, during these services, our clinical practice going to improve or it will be static?
Okay, clinical practice. Yeah, Nishant.
Hey, see, the whole of this webinar was on what is the type of work. So as far as you can, I can just give you a gist that if you are posted in these dispensaries, MCDs or health unit levels, your clinical practice will be 50% and 50% will be your administrative work. And if you are posted into the hospital settings, you have to be more engaged because you will be the junior, you will not be doing the administrative work. So your will be the clinical practice. Though in 50% you will face whole lot of people that you have to repeat the medicines. Means my 4 years of experience now, I came as a PG, as a general medicine PG right now. It's very easy for me because I know each and every drug, I know each and every cardiology, everything was clear. For 1 month, it took me 1 month to catch up. Now I'm seeing the patients independently. So it depends on you how you approach to that. Second thing is that the thing is that if your main concern is a clinical practice and only the clinical practice, then these services is more of a having being an administrative officer also. So even if in a CGHS cadre, right now not in MCD, the Sapriya has not faced, but there are many people who are doing this administrative job also. So it's a part of our job to perform an administration because here we are discussing a doctor who is in doing his practice or seeing the patients, but he is also an administrator. So being an administrator, it is more important profile. So you have to see that what we are discussing and what this job demands from you. That's it.
Okay,
There,
thank you, sir.
there are a couple of questions regarding Salah. Yes, we do have a website. There are lots of amazing mentors available, and Dr. Nishan, Dr. Sagar are available there. You can block your time with any one of them, and just then accordingly, team will help you with organizing your one-on-one call with them. And there are mentors available, yes, for UPSC CMS written examination and NEET PG examination. So do check it out. Coming back to, we'll take one last question that is from Vimal Kumar for ESIMO, whether they will choose based on UPSC CMS final result. I have no idea how to.
Sagar will, the ESIMO is different here.
Yeah, this time they have started taking on the basis of CMS marks. Those who have not cleared the interview and they are those who are in recommended list, they will be directly qualified for the ESIC, and they'll give you the merit list according to the CMS marks.
And regarding this webinar, yes, within a week, this webinar will be uploaded on YouTube. You all will be notified once it will be available on YouTube for rewatch. I think we are ahead of time. Thank you all for joining in, and thank you, Dr. Nishan, Dr. Sagar, Dr. Sapriya, and Dr. Abhishek for your time. And we have to close it. I'm so sorry. I know you all have lots of questions in place, but we have to close it now, and we will keep having sessions like these to help you out.
Thank you,
Thank you.
ma'am.
Thank you all. Good
Thank you
night.
all. Good night.
Thank you.
Thank you.
Good night. Good night, ma'am.
Good night.
Good night. Good night.
Good night.